And I'm pleased to be joined by Dr. Lisa Hernandez, the City of Berkeley Public Health Officer. And our city manager is out of the office today, but we're very pleased to be joined today by Deputy City Manager Paul Budenhagen, who's also the EOC manager for the City of Berkeley and coordinating our EOC efforts over the past several months. So before I go to Dr. Hernandez provide an update on the City of Berkeley's efforts to fight COVID-19, sadly, we learned this past week of 2 deaths of Berkeley residents. And I think this really highlights the critical importance that we continue to shelter in place, continue to wear a face covering when we are outside, and practice social distancing. It's critical to control the spread of this deadly virus and to keep you and your community safe. We do know that throughout the country, and even in Alameda County, the number of cases is sadly increasing. That's also the case in the city of Berkeley, although our rate is lower than that of other jurisdictions. We need to continue to be vigilant. I know that it's been close to 5 months since the shelter-in-place order first went into effect, and I know how challenging it is, not just for our residents, but also for our businesses. But it is essential to keep our community safe and to get through this pandemic and to make sure that we can safely reopen our economy, that kids can go back to school, that we can go back to work, that we can begin to return to the life that we had before this pandemic. But we know that this pandemic is going to be with us even after shelter-in-place restrictions are lifted, until we have wide and mass availability of a vaccine. The risk still continues, and we've learned that the risk may still even be there even after a vaccine is available. So I'm really proud of how our entire city organization and our community has rallied to fight COVID-19. I also want to acknowledge that Deputy City Manager David White is also on the call and also able to answer questions as well. So sadly, the announcement of these deaths I think really illustrate how serious this threat is and continues to be, and the need for us to continue to be vigilant and to continue to be safe. So with that, I'd like to now recognize our City of Berkeley Public Health Officer, Dr. Lisa Hernandez. Thank you for joining us, Dr. Hernandez. I know you're incredibly busy, but if you can please update us on the number of cases in Berkeley and in Alameda County, and any other news or developments you'd like to update the city on around our response to COVID-19.
Sure. Good afternoon, everyone. And as the mayor mentioned, we did have 2 additional cases, deaths that were reported to us in the last week. And it does highlight the severity of this illness. Actually, there was a new report that came out, I believe, yesterday from CDC that indicated gave us a little bit more information about the disease that I also want to highlight, which is that about 1/3 of individuals who are not ill enough to even be hospitalized have persistent symptoms for weeks to months after they've been recovered in terms of being contagious of this disease. So a lot of individuals, 1/3 of them, are still suffering from this illness after they've recovered from the acute part of their illness. And that includes fatigue, muscle pain, and some other neurological conditions. So this is a new disease. Yes, we've been working and learning about this disease for the last 6 months. However, we're learning more and more about this disease. And one of the things that we know is that it does have continuous and persistent impacts on our community, whether it be something as severe as a death, which will never minimize that impact, or to the chronic impacts of fatigue or pain that a lot of our residents and loved ones experience. So now I'll get down to the numbers. In terms of the numbers for cases in this county of Alameda County, we are now at 7,471 confirmed cases and 147 deaths. In terms of City of Berkeley, we're at 362 confirmed cases with 3 deaths, and those last 2 were reported just recently to us. One actually occurred in May, but due to the discussions with the state in terms of determining place of residence. When this individual passed away, this person is considered a City of Berkeley resident. And the last case did occur in the last few weeks. Those two recent individuals were deaths were in individuals who were above the age of 65 and also with underlying chronic conditions. So wanted to highlight that, but again, do not want to minimize the impact of this disease on individuals. In terms of total tests reported to us on City of Berkeley residents, we are now at 17,473, with our average seven-day average of daily tests at being at 282 tests per day. That is above the target that we have both set for us by the state and also set by myself and the other health officers in the 6 other local health regions in the Bay Area. So that is great news in terms of our testing capacity. In terms of percent positive, which is gives us a bit of an idea of the amount of disease circulating in our community, we're now at 2.2%. That's an increase from the last report I gave to you 2 weeks ago, where we were at 1.6%. So what that shows us that we are having elevated levels of disease circulating in our community. It is below the rate that the state considers concerning, which is at 8, but it is concerning. I am concerned with that level of transmission in our community. And what we're seeing in the cases, I would say we had a peak in the last month. We had a peak twice. One in the last month, which was on July 2nd, and the second was on July 13th. On the 2nd, we had about 22 cases reported to us. And on the 13th, there were 16 cases reported to us. And I know there's a lot of information and news about Cal students. They definitely contributed to the numbers there and continue to contribute to our numbers. But I want to make sure people know that it's not just Cal that is causing disease transmission to be increased in our city. We're seeing a lot of what we consider community transmission, where we are not sure exactly where people are getting the disease, but they are getting it in the community when they're outdoors, or when they're out participating in their normal daily activities or at work. We're definitely seeing a number of workplace exposures, which some of the residents are workers here in the City of Berkeley, and some are workers that reside in other jurisdictions but work here in the city. So we are definitely seeing that, where there's community transmission, worksite exposures, and then congregate exposures, which would include Cal students. But I just want to make sure people understand that this disease isn't just solely due to transmission due to Cal students. We are seeing people that are not complying with face coverings or are socializing outside of their bubbles and are not wearing face coverings as well. So that's what I wanted to talk about in terms of cases and what we're seeing. All this data is actually on our web. A new piece of data that's out there that we haven't put into a graphic yet is our data in terms of age distribution for the City of Berkeley, and that's in our open data portal. So you can see that, and basically what we're seeing is that in terms of number of cases, the groups that are most contributing to disease in our city include those that are age 50 to 70, so those that are working outdoors and going out to work, as well as those under 30. So those are the two groups that we're seeing are contributing to our disease here in the city. That's on, and again, that's in our open data portal. Hopefully we'll have in the coming weeks data displayed on our graphics. So that's available in a way that we can see that a bit more clearly. The other thing I want to share is our worksite exposure toolkit that is available for employers in the city. And it's a toolkit that helps workers or employers know what to do before they have a case and when they have a case. And that was created in collaboration with the disease containment unit, the public health nurses that work with cases and with our work sites when there are cases or outbreaks, as well as our Office of Economic Development and our Joint Information Team, our Public Information Communications Team. So that's available. And the website is www.cityofberkeley.info/COVID-19 worksite exposure. So it's very easy to find. But if you go to our worksite and you see information for businesses on the COVID worksite, that's where you'll see that. You'll click on that and then you can find that worksite. I feel that it's a great resource. We actually got it out before the state got their worksite kit out, and that's also available as well. The state has some guidance and they're consistent. In terms of how are we doing in terms of our shelter in place, we continue to remain paused. We will not be relaxing our restrictions at this point. The city of Berkeley, as well as Alameda County, remain aligned with that plan. We are also continue to be on the county watch list, and we were placed as a county on that watch list because of the increased cases and hospitalizations that we're experiencing in the county and the city. And once we get placed on that watch list, then we have additional restrictions placed on us, and we cannot open any businesses for at least 3 weeks or until the state health officer allows us to. So we remain on pause, one, because of what we feel is safe for our jurisdiction and county, as well as the restrictions that have been imposed on us by the state health officer. I wanted to review the indicators very quickly. These are the 5 indicators that the health officers are using to help see how we're doing, how we're complying, and if and when we're able to open up more. So indicator 1 is cases and hospitalizations being flat or decreasing. We have not met that. Indicator 2 is sufficient hospital capacity to meet community needs. That is met. We have about 3,000 hospital beds in the county available to us to utilize. As of yesterday, there were about 160 individuals hospitalized across the county. So we definitely have sufficient capacity for hospitalizations, both for intensive care as well as for routine hospitalizations. We have, both as a city jurisdiction and a county jurisdiction, started the conversations or ramped up our conversations with hospitals to assure that they have the capacity. They had surge capacity that was created early on in the pandemic, and that continues to be available. So we feel comfortable with what we have now with our capacity and moving forward as well. In terms of our testing capacity, that's our 3rd indicator. We have met that capacity. It's been over since mid-June that we've reached that sufficient testing capacity. I'll talk a little bit about testing in a second. And then our 4th indicator is sufficient case investigation, contact tracing, isolation, and quarantine. We have not met that indicator at this point. A good reason for that is that, one, we've started onboarding more staff. We have additional staff that we're getting from the city as well as from the state, and they are getting trained. And it hasn't changed our disease containment efforts. It has changed our ability to input the data so that it shows that those efforts have been performed. So we've done the training and we're working on the training, as well as transitioning to a new contact tracing platform. So those efforts have reduced our ability to put the data into the system. It has not reduced our ability to actually control and contain the disease with our disease containment staff. I just wanted to let people know that. Our last indicator is PPE, personal protective equipment capacity. That one continues to not be met. The hospitals have sufficient personal protective equipment, but the other facilities in our community continue to request personal protective equipment assistance. We know that the supply chain has been reduced, and there's also been an increased need for PPE, not only within our city, but also in Southern California, where there are increased cases and hospitalizations impacting the hospitals, and the need for the PPE to be provided to that area of the state. So the suppliers are using their supplies to go towards Southern California as opposed to here. But we have the capacity to get that for our providers if need be. I spoke a little bit about the disease containment unit already. We continue to work on the additional cases with our expanded staff. We are also working with UC Berkeley, who also is providing support on contact tracing and case investigation. And they work with us specifically on the cases and outbreaks associated with the student housing and the fraternities and other campus housing situations. They're also working on doing outreach to students. The Student Health Center, TANG, has been doing Zoom calls with the fraternities and the houses to do some education and outreach. So I just wanted to point out the partnership between TANG Health Center, UC TANG Health Center, and the City of Berkeley, especially our disease containment unit. In terms of testing, we have 2 test sites that are specifically either supported by City of Berkeley or run by City of Berkeley. One is the Optum site, which is a test site. There has been some delays with results, not only from that Optum test site, but in other labs throughout the state and nation. And a lot of that has to do with the increased demand for testing and need for testing. And then there's been a delay in those reports, and definitely not acceptable. We know that that's a challenge. We've been working with the providers and with the state to see about shortening that turnaround time, because it does impact our ability to control disease and individuals to isolate if they're sick. Our City of Berkeley 6th Street test site also has a mobile component to it that I wanted to highlight, that is focused on targeted testing, specifically in communities that are underserved and or lack access traditionally. That would include communities of color. We've done testing with partnerships with Latinos Unidos, with certain churches in the community, and they're continuing to work to bring testing on site to those facilities. Also working with senior apartment complexes and also with the long-term care facilities to do their surveillance testing for their staff. So that's one thing. And the last 2 things I wanted to talk about is school. We know that the governor released guidance about schools last Friday, basically saying that any jurisdiction that was on the watch list could not start school, and on the watch list for 14 days could not start school in person. BUSD had already announced before that they were going to online schooling. I support that. We support that decision because of the impact of disease in our community, and we're working with BUSD to make sure that schools, families, children, staff are protected and supported during this time, both from disease and from the impacts of not being able to be in school for in-person instruction. And the last thing I wanted to mention is tomorrow, there's going to be a COVID webinar in Spanish through a partnership with Latinos Unidos, myself, Elisa Gallegos Jackson, who is a public health nurse in communicable disease, and a staff from Berkeley Mental Health will be there to present and answer questions for the Spanish-speaking community in the city of Berkeley. And I'll end my report there, and I'm looking forward to answering any questions that come up.
Thank you so much, Dr. Hernandez. And I want to go to Deputy City Manager Paul Butenhagen. And Deputy City Manager Butenhagen, if you can give us an update on city operations, and you're actually well positioned to do that as you are managing the EOC. So anything you can update us on the administration's work in the EOC and in the community. And I know that we had a lot of questions around enforcement of the face covering rule. And if you can update us on the city's efforts around enforcement of not just the face covering rule, but the other shelter in place requirements.
Sure. Thank you, Mayor. And I'm happy to be here with you and Dr. Hernandez today. Again, my name is Paul Buttenhagen, Deputy City Manager. The EOC, so the EOC has been activated in January partially, and then shortly thereafter fully. Since then, we've had 80 to 200 people, city staff, pulled from all different departments to support the effort of responding to this pandemic. And those staff have done the work that Dr. Hernandez has just described, as well as done a ton of communicating public health messaging out to the city, to the residents, and internally have figured out how to operate our essential services. So we've had our refuse drivers, for example, out since day one. No, they've not missed a beat. To your question about city staffing and operations, we've had the whole big transition to, as everybody has had to make, to telework has been a big lift for staff. And we've got all of our city staff who are now currently working. Many of them are doing telework, which is fantastic. We've figured out some more efficient ways to do work, actually. We're doing more telemedicine, for example, and doing other telework that's really benefited our efficiency. For example, our planning department now is doing most of its work remotely, and it's not missed a beat in terms of responding to community needs. So that's great in that respect. I will say, though, that standing up the EOC has pulled a lot of staff out of normal work that they would have done. And that, is something that people may feel when they want services, because we've got 80 people who would have been in their departments doing regular work now who are communicating the efforts of the pandemic response, or they're staffing the test site centers, or they're responding to 311 calls when people have concerns or complaints about, or just questions about what's going on. So I just want to say how proud I am of staff for really stepping up and responding to this pandemic so supportively and collaboratively and thoroughly. And want to thank both Dr. Hernandez for her leadership and the mayor for your leadership in this. Very much appreciate that. On the, as you said, we certainly have been getting complaints about people complying or not complying with the masking order and with the health officer's orders. I'll say I bike and walk in Berkeley every single day. I always wear a face covering like this. For me, it has the added benefit of covering up this gray in my beard, which is fantastic. And it's, it's a behavior change that takes a little getting used to, but once you get used to, it starts to seem normal. And so I want to thank all the people in Berkeley who are wearing their face coverings and are practicing social distancing. And that, in my experience, just being out and around in Berkeley, is most people. However, it's not all people, and we do all need to do our part. As Dr. Hernandez and the mayor have both said, we need to protect each other by taking these measures. And so one of the things that we're now amplifying is what to do when we have people who don't comply with the health officer's order. So I can say that we have a team in the EOC who's responding to complaints. We've received since April 1st 120 complaints about businesses not complying with the health officer's order. Some of that is, people going into places without having masks, or perhaps employees not having masks, or they're not being social distancing being observed. Each of those 120 calls has been responded to. We have a team of staff in the EOC, and we keep good records of all of this. Businesses who are not complying get a call from the EOC, from somebody there, our emergency operations center. And oftentimes we're able to talk with them and figure out ways that they can comply. And that's happened a lot. When that doesn't happen, we again call. We will follow up with a letter telling them that this has been observed and that they need to comply. And then we've also had some staff, for example, from our environmental health division, go out to restaurants or other places that we've had complaints about people not wearing face coverings, and actually meet with the people who work there and who operate the facility to let them know that we really, they need to comply. How can we help you comply? And if people don't comply, that there could be consequences. So as of today, we have not shut anybody down, and we have also not levied fines. Under state law, the violation of a health office order it's a misdemeanor, but state law doesn't provide a civil mechanism for us to enforce the health officer orders. So, for example, we can't fine people right now, but we are prepared to bring an item to council in September when we resume that would give us the authority to impose civil fines. And then we would have staff. Again, our effort is educational. Our effort is to try to be supportive and proactive, to do as Dr. Hernandez said, and point people to resources that we have online that can help them get in a place to comply. But then if they don't, we would have a mechanism to impose fines. So that's something that we're prepared to do and looking to do in September. I'll say also that that could be either a business or an individual. So it could be people who just aren't wearing their face coverings, and we would have staff that we would deploy to monitor hotspots and then to respond in that way. So those are things that we are as a city now working on. Again, those complaints you can call 311 if you're watching this and want to let us know about an area or a business or a hotspot, whether that's a park or a part of town or whatever it might be, where you see people not complying with the health officer's orders for face coverings or social distancing or in general. And then we would take that up through our EOC in the ways that I described. But again, I do want to go back and thank people, the majority of whom are working really hard to wear their face coverings and to social distance. So I hope that helps.
Okay, thank you very much. So let's now go to your questions. And we received a number of questions that were submitted through a form on my website, as well as questions that were sent to us by email. Any questions that we do not get to, we'll get to at our next town hall 2 weeks from now. But to the questions, Mr. Boonhagen, you already addressed the issue of the enforcement of the face covering requirement. There were a number of questions regarding this issue, and noting that some jurisdictions are actually imposing fines, and is the city of Berkeley considering the imposition of specific penalties? And I know that in the fall, when this council reconvenes after our summer recess, we will be considering a proposal to impose monetary penalties, to give the city the ability to impose those monetary penalties for people that don't comply with the face covering requirement.
Yes, that's right.
But we do take very seriously the concerns that have been expressed around people not wearing face coverings. I will note that most of the people that I do see are wearing face coverings, but we still do have a lack of compliance. And so this is an extremely important issue. We're not only going to be addressing this from an enforcement perspective, but also from an education perspective. And we'll be working to launch a community-wide education campaign about the importance of people wearing face coverings. We also have signs that are in city parks and in medians and throughout the community, encouraging people to wear face coverings and to follow the public health guidance. And so it's extremely important that we just continue to remind people about the importance of this. And as you noted, Mr. Boonhagen, it really is a culture shift. You really have to really make it a routine and just have it with you every single time you leave the house. Yes.
If I could add really quickly to that, Mayor, to just amplify your point about the education, as you said, we have put out 500 signs throughout city parks reminding people that they should be wearing their masks. We'll be ordering more of those signs to put out in both Spanish and English. And then we also have staff who are handing out masks. We have 3 staff from the Parks and Rec Department who every weekend go through the parks. They have a whole bag of masks and they hand them out to people who aren't wearing them, and they remind them that they're supposed to be wearing them. And we've also given 500 masks to the downtown business ambassadors who are also handing out masks to people downtown. So that's another element of the education, is just having those masks with some city staff and providing them when they see people not wearing them. So I just wanted to add that a little bit.
So, Mr. Budenhagen, who do people call if they see employees or businesses that are not complying with this particular requirement or any of the other public health directives?
The best thing to do is to call 311 and make that lodge that complaint with 311, and then 311 will get it to the right place where it needs to go, and we'll work on that with the EOC. We're considering putting together a different separate complaint number, which we may do, but 311 is a convenient way for people to, and easy to remember.
But for now, we're not issuing citations to people that are not wearing the face coverings. We are encouraging people to be good citizens, and to follow this requirement, because it's important to reduce the spread of COVID-19. But we will potentially move in that direction of giving the city the authority of issuing citations like some other jurisdictions have done.
Yes, exactly right.
So I think we addressed the enforcement issue. So if we can go to a couple of questions around homelessness. This question was around what is the city doing to manage objects and debris around tent encampments. And this individual noted that they think tents are fine if they're kept neat and out of the way. So Mr. Budenhagen, if there's anything you can add about enforcement of some of our regulations around camping in parks and temporary non-commercial objects on sidewalks.
Yes, Mr. Mayor. That's always a tricky issue. It's been made much more tricky in the current environment. CDC has put out guidance really recommending that homeless encampments and people that are camping not be dispersed from where they are, so that they can comply with the shelter in place in the same way that people that have a house can, or in a similar way, as similar as possible. And so, that's one element of that, but then that also needs to be balanced against the impact that people may have on their neighbors. And so when there are camps or people that are pitched a tent downtown or wherever, and they have things spread out all over, that can have a negative impact on people nearby. And so one of the things that we've done is, let me just say first, we have, there's 4 different teams of homeless outreach that respond throughout the city. The city has staff in their mental health department and the HOT team who go out, and they go out Monday through Friday. And they talk, they engage with people, they ask them how they're doing. If they see people who look sick or who might be reporting that they don't feel well, they connect them with a COVID test through one of the other teams, which is Lifelong, who's doing street-based COVID tests. And then we also have the Berkeley Food and Housing Program homeless outreach team who goes out also weekly. And those folks meet, they decide where everybody's going to go every week, then they report back. They provide food, they provide water, they provide mental health support and COVID screening and testing. They also really remind people to try to be good neighbors and to be mindful of how they're impacting people around them. And so that's another part of it. In addition to that, we have a team that's part of our neighborhood services division that goes out with public works. And what they do is they really remind people that they need to be good neighbors, and they also bring a public works truck that can remove unwanted trash and debris that people have. And I'll say we've been doing that for a while. We've amplified it lately. Last year we removed 100 tons of trash and debris from homeless encampments that homeless people said they don't want anymore. So that's a service that sort of helps to mitigate that. And then, that team also really just provides that trash service and reminds people that it's important to be good neighbors, and for them to, as this person who wrote the question is, keep your things inside your tent, don't block the sidewalk, be mindful of the people that are living around you or walking past on the sidewalk, so that they don't have to, go out into the street or do something like that. So that's the way we've been moving forward with that. We're gonna amplify that this coming week by adding another person to that neighborhood services team from our another mental health person. So hopefully all those efforts will start to, you'll see that.
Thank you so much. There was a question around the encampment in People's Park, and I'll just note I did speak with Chancellor Christ about this a week ago, and the university is similarly thinking about how to manage people that are living in People's Park while trying to follow the CDC guidance, which is do not remove encampments, as that puts people at greater risk of contracting or transmitting COVID-19. But they're also looking at how to manage the large accumulation of objects and debris in People's Park while also safely ensuring that people can, continue to camp there.
Yeah.
So I don't know if there's anything to add
I'll-
about People's Park.
a little bit about People's Park, and I go by there fairly regularly. If for people who've been there recently, you can see the eastern third of that park has really been filled with tents, and there has been definitely an increase in the number of people camping in People's Park. I know, as you said, Mayor, that's UC property, and they've been involved in supporting how that is. Just this week they did clean up. They did a pretty big cleanup, so they asked folks on the eastern side to move over to the west or move out, and then they started to clean that area, and then they're going to move back and do it the other way around. So they are paying attention to it, and we are supporting them as best we can in that as well. But that remains a challenging situation for everybody.
Yes. There was a question around the encampments along Interstate 80 at Gilman and University. I want to note that that property is owned by State Caltrans, and we have been working not just with Caltrans, but with the actual unhoused community that's living there around managing the amount of objects and debris that's accumulated so that people can safely live there. Mr. Budenhagen, do you want to touch on sort of the city's efforts around looking at creating a sanctioned encampment model?
Sure. So I'll add a little bit to what you just said and say that the city did put a big dumpster just north and east of that encampment on the closest city property to the I-80 encampment there on the Caltrans land. And that dumpster is for people that are living in that camp to use, and it gets regularly emptied by the city staff and taken to the landfill. Also, we provided a bunch of wheel cart for trash down there, and have installed a permanent water feature as well as sort of regular outreach there. So there has been a lot of activity there. As you noted, it is a Caltrans parcel, but they are people that we want to try to figure out how to help as best we can. In terms of sort of a sanctioned outdoor encampment model, we are definitely looking at that. The city has purchased 30, they're called pallet shelters. So they're like little kind of pop-up shelter that has a space for a bed and has the option to do solar power on it. We have looked at the back part of the pathways parcel, and we can fit several of those, probably about 10 to 12 of those pallet shelter units there at the end of pathways inside there outside, which would add capacity to that shelter there. One of the challenges that we've talked about before is during COVID, congregate settings are dangerous places for transmission of the disease. And so we've reduced the number of people living in congregate care in our shelters for fear of having some sort of an outbreak there. And then are figuring out, like through both hotels and then maybe this pallet shelter model, how to get people into other accommodations that were living in those shelters. And so, but we are also actively looking throughout the city for where we could locate an outdoor encampment. It's tricky on the Caltrans parcels, but we are looking in other places as well.
Great. There was a question about the status of COVID spread among homeless encampments in Berkeley, and either Deputy City Manager Budenhagen or Dr. Hernandez, is anything you can share with us around, are we seeing a spike in COVID cases among homeless encampments in Berkeley?
I can answer that unless you want to.
No, go ahead.
Okay. We are not. I would say that early on, we had a few cases and individuals experiencing homelessness, and we have not seen any increases in cases in that population, fortunately, due in part, I believe, to some of the efforts that the Deputy City Manager outlined, which include decompressing the shelters, providing support and education. The shelters are required to comply with face covering guidance that was issued early in April, in terms of making sure that staff as well as individuals receiving services in the shelters wear face coverings. So, and I feel that they've been pretty compliant and have been a great partner in terms of controlling the spread of COVID-19. We're fortunate for that partnership and working closely with our unhoused team, both in the EOC and through some of the departments that we have and divisions that we have within the city staff. So I'm happy to report that, and I'll hand it over to the Deputy City Manager.
Well, I would just echo your comments. I'll say for us in the EOC, and you'll remember this too, Dr. Hernandez and Mayor, one of the things we were really, really worried about in the beginning of the COVID outbreak activation was how are we going to support people who don't have homes, particularly those who are living in congregate care or in close quarters outside in encampments. And we really, as Dr. Hernandez said, spent a lot of time through, there's a specific group in the EOC called the Vulnerable Populations Group, who focused a lot of energy on quickly decompressing those shelters, making sure we were partnering with the shelter operators and the people who were living there on what good public health looked like. And we're providing both that guidance and some of the tools so that they could effectuate that. And I don't want to repeat everything Dr. Hernandez said, but I just wanted to amplify that. And so that all happened, which is great. And I think definitely did have a role in it. And then I don't know how else to explain it also. I mean, maybe we just got a little bit lucky or who knows, but we'll continue to work with them in the ways that we have and move forward with that.
Thank you very much. There's a question around enforcement of parking regulations. And the question specifically is, what is the current status of issuing parking tickets? They noted that there is enforcement of parking time limits in the downtown. And there was a question of whether the enforcement is also occurring in residential areas.
Yeah, so we are not ticketing people who are, in the RPP zones, who are staying beyond what they should be staying, or who don't have a parking permit to park there, except on street sweeping. But we're not having our parking enforcement go into the RPP and enforce in those areas. We are, as you said, enforcing meters. We do also have the Center Street garages open. We've reduced, there's just been so much reduced demand that we've reduced the number of floors of parking, but there's still plenty of parking in the garage if people want to use that.
Okay, thank you very much. Last question is about signage. We touched upon this earlier, that we put about 500 signs in city parks and medians throughout the city. I believe you said that we're going to be increasing the amount of signs we're putting out there in the community. Now we're looking at other ways to educate the community through a public education campaign. Maybe we'll consider banners. So we note that there's more that we have to do around getting the word out about the need to wear a face covering. But I also want to note that businesses are already required to put up signage. And in addition, we posted signs in parks reminding people of masks and social distancing. So that will be an ongoing effort, certainly, while COVID is with us. And if there's anything else you want to add, Mr. Deputy City Manager.
No, I think you covered it, and we really appreciate working with you on that, and very much are looking forward to amplifying that messaging throughout the city in some sort of a campaign. And we're, as I said, we'll be ordering more signs to put out. We'll have those out in Spanish and English. If people have other suggestions about how they think the message should go out, we'd love to hear it.
Yeah, thank you so much. Dr. Hernandez, a few questions. This one is about businesses reporting COVID cases to our public health department. So are all businesses required to report COVID-19 cases to public health? If so, what additional information is required? Example, whether the individual is hospitalized. If yes to either question, can the public access information? If so, how?
So the toolkit that I mentioned earlier for work sites has all the information that we're asking from businesses. So the short answer is yes, they're required to report cases to us. We want them to report to us when they have 3 cases or greater than 2 or more, essentially. They have guidance on how to manage 1 case. We're always available to provide guidance and support if needed, even earlier than having more than 1 case. So when they do have more than 1 case, then we want to know information about that individual. Oftentimes, those individuals do not live within the city of Berkeley, so they're not a reported case to us, but they're in another jurisdiction's responsibility. So we need to get contact information on that individual and either get the information from the other jurisdiction, or what we end up doing is interviewing that person ourselves to understand specific information to see what level of exposure has occurred in the work site. Sometimes there's no level exposure, that they tested positive, but they hadn't worked during their infectious time, or they weren't exposing other individuals, whether they be members of the general public or their coworkers. But that being said, we find out about their time that they were contagious, what their activities were, and then we also work with the work site to find out that same exact information to confirm what we hear, to have a comprehensive understanding of the exposure. And then the work sites are required to report to us every additional case that they have. And we also work with them on quarantining contact. So let's say there was an exposure at the work site and an individual exposed his or her coworkers. We determine of those people that they expose who would be considered a close contact. And that is having contact with a case for greater than 15 minutes within 6 feet. So most times members of the general public at, let's say, a retail establishment, a grocery store, what have you, are not having that level of exposure, but co-workers may. So that's what we consider a close contact, and that's who we would be quarantining and requiring them to stay off work from 14 days from the last contact from that case. We do not release this information out of specifically about retailers or any businesses in our jurisdiction. So we don't have that listing. We don't provide that information out to the public. We would release information if there was a need to protect individuals' health. So let's say, for example, there was an exposure that constituted alerting the public because we couldn't identify them directly. So then we would release that information with specific information about who would be considered a contact and who would need to either isolate or get tested depending on the situation.
Thank you so much. There are a few questions around the mask requirements.
Yes.
And some confusion around, what is the minimum number of feet where you have to wear a face covering? Is it 6 feet? Is it 30 feet? And then specifically, are children 2 and over required to wear face coverings? And then another question, which I'm going to fold in, is, did the governor change face covering requirements for children again?
that I know there's
multi-part questions. So.
Yeah. So I tried to write it all down.
Okay.
So in terms of the age, it is the governor has required that individuals over the age of 2, so 3 and older, have to wear face coverings. I think the confusion about face coverings and the question about did the governor change his guidance again about face coverings for children has to probably do with the requirements for in a school setting. Where in the school setting, it is recommended that children under 3rd grade wear a face covering, but then from 3rd grade up, they're required to. So and that is in a specific setting of a school. And that is kind of going along with that social bubble and some of the other other restrictions that are going to be in place in a school setting when school is allowed to convene. So I think that's the question. What the person who's asking that question is asking about is that differences in requirements based on a setting for children. The next question about 6 versus 30. The 30 feet is a city of Berkeley requirement, which says that you should, if you're outdoors and you know you're going to anticipate passing an individual and not being able to maintain that 6 feet distance, that's when you should start wearing your face covering. We want people to have those face covering, and they're required to have them when they're outdoors, but they don't have to wear them until they are going to come within 6 feet distance. But we know that people walk faster than others, and we have to remember to have that face covering on before you come within that distance of 6 feet. So that's where the 30 comes from. So hopefully I answered that question.
Yes,
and all the parts of it.
You did. There was a question around pools. Why aren't Berkeley pools, which are outside recreation, open under stage 2 like tennis courts? Other counties have designed safe protocols that Berkeley can use as models. I know this has been an ongoing question that we've received.
Yes, I know. And I think I've also told you I have swimmers at home, so that's an ongoing question in my household as well. So right now we're on pause, as I mentioned. We're not adding any additional activities to what is allowed not only in the city of Berkeley, but Alameda County, because we know that any additional activity increases additional mixing of individuals. And because we're still seeing increased cases and hospitalizations in our county and city, we're not adding swimming to that, to those activities. And we're also not allowed to by the governor and the state health officers rules. I will hopefully be able, we'll, as soon as we can, that is definitely an activity that we're looking to add to the to what's permissible because of just what the individual mentioned. It's outdoors, and there's definitely guidelines that we've seen and that we're ready to apply to City of Berkeley when we're able to.
Thank you so much. A couple of questions around social gatherings. What is the current policy on the number of participants who can congregate in a social gathering? Specifically, is a small barbecue advisable? And then third related question is it okay for groups of 4 to 8 people to work out in a park without masks or social distancing?
Okay, so I think I got the notes for this. So the what is still allowed is what's called a social bubble, and it is a group of 12 or less individuals that are a stable group that can come together socially outdoors for 3 weeks. So you have to have that stable group for 3 weeks. You can't introduce any others into that social bubble within that 3 weeks, and you can't be part of another social bubble until that time. So basically that group, we recommend that they are wearing face coverings and are socially distanced. That's the best type of social bubble to have. So if you want to barbecue within that social bubble and are socially distanced, that's okay, as long as that's allowed by City of Berkeley. Other non-COVID restrictions, I don't know if there's any of those restrictions, but yes, that's allowed. And there was I feel like there was another question that I'm not answering.
I think the question was really around what is a appropriate number, and you said 12 within
Yes.
the social bubble. So
Yes.
So that continues to be the policy.
Yes.
Okay, thank you. Couple of questions around testing. And I'll just summarize these 2 questions in one question. Concerns were expressed around the amount of time it takes to get test results And what is the city doing around trying to have a quicker turnaround time for test results?
So as mentioned earlier, that we are seeing that turnaround time being excessively long in various test sites, not only the Optum test site, but other test sites and other providers are experiencing that same lag. What we're doing is we have a twofold approach to it. One is that we're trying to see about increasing the availability of testing and shortening the turnaround time so that supply and demand, we know that there's a demand and our supply is low in terms of having test kits as well as having the capacity at the labs to run the tests quicker. So that's not unique to Berkeley or the state, it's a national thing that we're seeing. So because of that, so we're working on that side and working with the state and working nationally on that. The other part of the approach is an order that I issued on July 15th, which is a blanket isolation and quarantine order. What that means is that if a provider is testing an individual because they're symptomatic, they should be handed a information pamphlet that says that you're required to isolate right now. And you're also required to inform your contacts that they have been exposed and they need to be quarantined. And there's specific guidance and definitions about what a contact is, what a close contact is, and what those requirements are. And those are also on our website, and providers are doing that here in the city of Berkeley. That is new for us, but that was issued by me because of that issue, that we were seeing the turnaround time for tests being too long for people to really safely isolate or quarantine if their contacts, because the turnaround time was close to the amount of time that they would be isolating or quarantine. So that's the two-pronged approach that we are taking on that.
Thank you so much. There was a question around transmission risk, and I'll just read the question. Dr. Tom Frieden says, we need to know, quote, what our personal risk is of getting COVID if we go out, and how well our government and society is doing in our community to reduce the risk. Can you answer that question in regards to both the city of Berkeley and Alameda County?
So can you repeat that again? What our personal risk is?
Personal risk if you go outside, and how are we doing to, as a government, to reduce that risk? Okay. It's kind of a high level question because we've kind of touched upon a lot of this throughout the course of this town hall. But I think really it's sort of what risk is there if you go outside, and what are we doing to try to contain that risk? Yeah.
So I would say one of the things that individuals could look at to look at your personal risk. Well, first of all, I would say you should consider your risk to be fairly high for getting COVID-19. And that's why we're using our face coverings that the deputy city manager has so beautifully displayed. But there he goes again. And that is why we ask individuals to wear face coverings, because we know that it reduces transmission and actually does seem in the new studies to reduce the chances of you getting, if not the disease, and more severe level of disease requiring hospitalizations or having symptoms. So I would say that that is why we're asking you to do the basic strategies to reduce your chances of getting disease: face coverings, social distancing, and hand washing. The other thing to look at is our percent positive rate, which is also displayed on our website. And right now, as I mentioned, we're at 2.2%. It is greater than it was over a month ago. So we know that community transmission has increased in our city. If you look at Alameda County's website, they have their transmission. The state has their percent positive rate as well. I believe the state is about 5% or a little northwards of that. And I believe Alameda County is a little below that. But that also shows you our general level of transmission in the city or in the county or state. And you can see the curve of that. So you see how it's changed, whether it's gone higher or lower. That's one of the other things that we would use. The other part I would say in terms of how are we doing with helping control disease, those are those indicators that we have that show how we're doing with especially disease containment and contact tracing. And so I would say that's the other part to getting an understanding and an awareness of how the government, how public health is working to help control this disease.
Thank you so much. Last question, or it's actually really a comment, I'll just summarize it. This individual is expressing concern about the county asking for a variance, particularly given when we're seeing an increase in cases. And while we are our own public health department, we are subject to the county's variance. And so a variance was requested by Alameda County and was granted by the state of California. And a variance, my understanding, just gives us the flexibility to ease certain requirements if we are meeting certain metrics. Anything else you want to elaborate, Dr. Hernandez, on what is a variance? And my understanding is that in no way prevents us from lifting certain orders or imposing more restrictions, that we still have that flexibility.
Yes, exactly. A great example of something that we were allowed to do with the variance that we weren't allowed to do, at least for a few days, which was outdoor dining. We were not allowed to have outdoor dining without a variance. And that's something that we are able to do, and we continue to allow both in the city of Berkeley and Alameda County because of that variance status. And then we're able to, if and when we're allowed to resume to add additional activities, we are able to add some if we'd like to. For example, swimming, because we're have attested and we have that variance status. The other thing that a variance does is that it actually shows the community our preparedness plans, and also kind of shows and verbalizes where we are with certain indicators, some of which are the ones that we display on our indicator progress report here in the city. They're very similar to those that the state is tracking. So it also provides an outward and public-facing document to show what our preparedness plans are as a county, and then how we're being measured on each of those indicators.
Thank you so very much, Dr. Hernandez. I'm going to take the next set of questions. And the first question is about city commissions. When will all the commissions finally be able to meet? So as we touched upon in previous town halls, actually prior to the shelter-in-place order going into effect in March, the city manager, in consultation with the public health officer, made the decision, and in consultation with the council's agenda committee, and this actually was subsequently ratified by the city council on March 17th, agreed to suspend certain non-essential commissions that don't have quasi-judicial business, like land use permit entitlement, Landmarks Preservation Commission and their consideration of landmarking, the Police Review Commission. And so over the last several months, the city managers actually increased the number of commissions that are able to meet. But the goal was not to stifle citizen participation in our government, but rather to ensure that our city workers who are being dispatched to the EOC, that they are focusing their effort on responding to this pandemic. So we will continue to evaluate whether to actually expand the number of commissions in the coming months. Mr. Boonhagen, I don't know if there's anything else you want to add on that.
Yeah, I would just agree with what you were saying. As earlier said, we've deployed, right now we have about 85 people who are deployed to our EOC doing all of the different work and aspects that it takes to respond to it, which would probably be like the 8th biggest department in the city. And so, those are staff who are the commission secretaries oftentimes who are pulled in to do this, and then plus are trying to do their other job whenever they can. So as there are urgent items that really absolutely need to be addressed, we can look at those case by case, and till then we'll kind of continue as we are.
Thank you so much. So the next comment was around dog sort of walking in our parks and a concern about our city parks have become de facto off-leash dog runs, and that it's important that we have signage and that we educate dog owners about where off-leash dogs can go and around leashing requirements. So I just want to highlight that. A couple of questions around election campaigning. This question, I had somebody come to my door who was campaigning for mayor. This is ridiculous. How can people knock on someone's door, masked or not? The city should pass an ordinance that no door-to-door campaigning should be done during COVID. Subsequent question, what are the rules around campaigning during COVID? Can people knock on your door? The shelter-in-place order, to my understanding, Dr. Hernandez, does specify that essential business includes government activity. And one of those things is campaigning. I don't know if there's anything else you want to add around the type of campaigning that could be allowed. I think it's gathering signatures, knocking on people's door, as long as you are socially distancing and wearing a face covering.
That is exactly right. And that was included in our original, I believe in our original shelter in place order back in March. And we might have clarified it along the way, but yes, that's been always permitted.
So it's not best to knock on random people's doors during a pandemic, but you are legally able to do it, as that is your First Amendment right. But you have to socially distance and wear a face covering. The next question was around our eviction moratoria and what's going to happen if COVID continues and the eviction moratorium ends. Well, people will become homeless. This is certainly something that we are evaluating. Our eviction moratorium is still in effect as long as the local state of emergency is in effect. We did expand funding for our housing retention program. We've been able to help hundreds of tenants stay housed and address their rent debt. And we need to fight for laws in Sacramento, as well as continue those protections so that people do not become homeless as a result of loss of income or loss of jobs, and can have these essential housing protections. This is a top priority, and we will continue to monitor and ensure that these essential protections are kept in place. And then last question was around the university and whether they intend to have football. And I just want to note that the university announced that football season will be reduced to matches only with teams in the Pac-12 conference. And as with other sports that are resuming, strict protocols will be in place regarding regular testing. And so additional details will be released publicly at the end of the month. But there will be a football season, albeit it will be a much more truncated season. There will not be fans at Cal Memorial Stadium, and there will only be matches between specifically Pac-12 teams. So that's the latest on that. So those were all of our questions. And if there were questions that were sent on Facebook, we'll add those to our list of questions to answer next week. I want to thank our deputy city managers for joining us, and Dr. Hernandez, and all their incredible work that they're doing for our community and keeping our community safe. And I'd like to give Dr. Hernandez, if anything else you'd like to add before we close, as well as Mr. Budenhagen, like to turn over to you.
Great. As usual, I'd like to thank the community for continuing to understand the importance of this pandemic. And we're here for the long haul, unfortunately. There have been some promising studies with developments for vaccine and medications, but there's still some time away for us getting that available widespread in the community. So we need to continue to do the basic things of hand washing, social distancing, and wearing face coverings, and not going to work when you're sick. I also want to thank my coworkers in the city of Berkeley staff who have been working tirelessly for this 5 to 6 month time. And it's great to have everyone supporting this effort and helping to support the community. And again, thanking city leadership for the support to this public health effort. I'll end there.
We're so fortunate that you make yourself available. We know how busy you are, and I know the Berkeley community really appreciates it to have this opportunity to engage with you. So thank you so much, Dr. Hernandez. Mr. Deputy City Manager, anything you'd like to add before we close?
Yes, just one thing. Well, first, thank you for the opportunity to join you here today. It's been an honor to be able to speak with you and the community about COVID and the city's response. We know that we'll be in this for the long haul, and we're, committed to doing everything we can to, make this as, safe and decent as possible for everybody. And having said that, we know that there are challenges everybody is experiencing with this. There's a lot of loss, and mental health is one of those challenges that all of us are dealing with in some way, shape, or another. And so, I would just remind folks that we have a COVID-19 page on the City of Berkeley's website. There are links to mental health support on that web page. There are phone numbers that you can call. We will be having this Monday and Tuesday, Monday evening and Tuesday from 11 to 12:30, a time for shaping the Mental Health Services Act services and spending moving forward. This is an opportunity for people who want to call in and talk about how they think we should be spending our mental health dollars to support people in the city. And I would encourage you to participate in that, or you could also send in emails. Again, you can just go to our COVID-19 City of Berkeley webpage, and there's a link for mental health, and that'll take you to all the mental health resources and to the two events that I just described. And so just wanted to also share that with people.
Thank you so much. So in closing, thank you for joining us. And please be safe. Please remember to wear a face covering when you are outside. Please remember to shelter in place and practice social distancing. It is essential to help control the spread of the virus. And I just want to not only thank our city staff, but all the essential workers, the nurses and doctors who are risking their lives to help people who are sick and to provide comfort for families, the grocery workers, the people working in our restaurants, the people that are helping keep our economy going. Thank you to our essential workers. As was noted, it's oftentimes our essential workers who are the ones who are contracting COVID-19. So I just want to express my appreciation to all the essential workers, our frontline medical staff, and our city staff, including our first responders that have done an incredible job in responding to this emergency. So please continue to shelter in place. Please remember to wear a face covering. Please be safe. Thank you, Berkeley, for joining us. We'll see you in 2 weeks, and have a good weekend.